I really wanted to discuss about this issue that has been discussed a lot in the media, especially after that missed case by one of the physician associates, and that was about the pulmonary embolism. Now, pulmonary embolism basically means a clot in the lung, and if untreated, it can be life-threatening as well. So we as a society need to increase the awareness about pulmonary embolism as well. And what sort of symptoms do we need to look for? Because the symptoms can be very subtle. And that's what my perception after seeing few of the pulmonary embolism cases in emergency department. So basically, the definition, as I described earlier, explains that the embolism means a clot, and a pulmonary means lungs, so clot in the lung. And there are few risk factors that increases the chances of having a clot in the lung. If someone has got a clot in their leg, that automatically increases the risk of having a clot in the lung as well. But if someone is already been diagnosed to have a clot in the leg, they would be started on a medication, which is basically a blood thinner, which would automatically reduce the risk of having a blood clot in the lung. But if you see a swelling in one of your leg and start noticing some breathing changes or chest pain, you need to make sure that you are looked up in emergency department in a hospital. So as I mentioned, the pulmonary embolism usually shows subtle signs, which could be some chest pain, breathing issues, and in some severe cases having blood in sputum as well. The description of the pains in some cases can be very typical, where they will have some pain when they breathe in, and the doctor described it as a pleuritic chest pain. So if there is a pain that has been not been treated, was considered to have, for example, a chest infection or a muscular pain, but that pain is more when you breathe in, then make sure you are getting tested. As I was telling earlier, there are a few risk factors that increases the chances of having a pulmonary embolism. It is a high time that we talk about that as well. Now, what could increase the chances? One was having a clot in the lung that I said earlier. The other one is any previous cancers that increases the risk of having a pulmonary embolism as well. If someone is, from a female point of view, if someone is on COCP, which is combined contraceptive pill, that increases the risk of having a pulmonary embolism as well. If someone had a major operation in the last 3 months, or someone is bedridden for a longer period in recent times, that increases the risk of having a clot in the lung as well. And lastly, if someone has had a long air travel, which usually is said to be more than 4 hours, that increases the lung chances of lung clot as well. And as I said, the symptoms could be very subtle sometimes. For example, simple breathing issue, which is breathless when you're exerting. That subtle sign could be one of the symptoms of the lung clot. So if you've got any risk and you have breathing issues and you've been treated previously for other issues, for example, chest infection, a muscular pain or inguinal pain, and that has not worked in your case, make sure you're getting assessed appropriately in one of the health sector, and the best place is emergency department of hospital. I'll be coming with another interesting video next time. Till then, take care.